Hello everyone and welcome to my channel. Iron is vital for several physiological functions like oxygen transport. It is a core component of hemoglobin in red blood cells and myoglobin in muscle tissues. Energy production. It facilitates electron transfer in mitochondrial enzymes. Enzyme functions. Acts as a cofactor for enzymes involved in DNA synthesis, oxidative metabolism, and detoxification. Iron deficiency can lead to anemia, fatigue, weakened immunity, and impaired cognitive functions, necessitating supplementation. Forms of iron in supplements. There are different types of iron that are used in supplements, depending on mechanism of action and bioavailability. So don't skip the video and watch until the end. 1. Ferrous iron supplements. Ferrous forms of iron are highly bioavailable and commonly used in supplements. A. Ferrous sulfate, most widely used form of iron supplement. Typically available as tablets, capsules, or liquid forms. Uses. Treats iron deficiency anemia. Mechanism of action. Provides elemental iron, which is absorbed in the duodenum. Supports hemoglobin synthesis and replenishes iron stores in the liver and bone marrow. Advantages. High bioavailability. Cost-effective. Side effects. Gastrointestinal disturbances, nausea, constipation. B. Ferrous gluconate. Iron salt with better gastrointestinal tolerability than ferrous sulfate. Uses. Alternative for patients experiencing severe side effects with ferrous sulfate. Mechanism of action. Similar to ferrous sulfate, absorbed in the small intestine and incorporated into hemoglobin and ferritin. Advantages. Mild on the stomach. Suitable for pediatric and geriatric populations. C. Ferrous fumarate. Contains a high percentage of elemental iron, 33%. Uses. Often prescribed for moderate to severe iron deficiency. Mechanism of action. Absorbed in the intestinal mucosa and utilized in erythropoiesis. Advantages. Higher elemental iron content reduces pill burden. Side effects. May still cause gastrointestinal discomfort. 2. Ferric iron supplements. Fe-cubed, ferric iron supplements are less bioavailable than ferrous forms but have specialized applications. A. Ferric citrate, iron salt with chelating agents. Uses. Treats iron deficiency anemia in chronic kidney disease, CKD, patients. Mechanism of action. Citrate facilitates ferric iron solubility and absorption. Provides bioavailable iron and reduces phosphate levels in CKD patients. Advantages. Dual action. Iron supplementation and phosphate binder. B. Ferric pyrophosphate water-soluble iron compound used in fortification and intravenous formulations. Uses. Fortifies food products and supplements in patients undergoing dialysis. Mechanism of action. Slowly releases bioavailable iron for absorption in the gut. Advantages. Low risk of oxidative stress. Gentle on the stomach. 3. Polysaccharide iron complex. Ferric iron bound to polysaccharides. Uses. Alternative for patients with intolerance to traditional iron salts. Mechanism of action. Delivers ferric iron in a stable, non-ionic form, reducing interactions with the gut lining. Iron is gradually released for absorption. Advantages. Minimal gastrointestinal irritation. Does not require co-administration with vitamin C for absorption. 4. Carbonyl iron, pure elemental iron powder. Uses. Prevents and treats mild iron deficiency. Mechanism of action. Slowly dissolves in the stomach, releasing iron ions for absorption. Advantages. Low toxicity due to slow absorption. Reduces risk of iron overload. Limitations. slower action compared to salts like ferrous sulfate. 5. Iron amino acid chelates. Iron bound to amino acids, such as glycine, ferrous biglycinate. Uses. Treats anemia with high absorption rates. Mechanism of action. Bypasses competitive inhibition by other dietary elements like calcium. Absorbed directly through amino acid transporters. Advantages. High bioavailability. Minimal gastrointestinal irritation. Factors influencing iron supplement choice. Severity of deficiency. Severe cases require high elemental iron formulations. Tolerability. Non-irritating forms, e.g., polysaccharide iron complex, are preferred for sensitive individuals. Comorbidities. Ferric citrate is ideal for CKD patients. Bioavailability. Heme iron and amino acid chelates offer the best absorption rates. Cost and accessibility. Ferrous sulfate is the most economical and widely available option. Absorption and bioavailability. Absorption mechanism. Iron absorption occurs primarily in the duodenum and proximal jejunum. Ferrous, Fe², forms are absorbed through divalent metal transporter 1, DMT1. Ferric, Fe³ forms require reduction to Fe² by ferric reductase for absorption. Heme iron is absorbed intact via heme carrier protein 1, HCP1. Factors enhancing absorption. Vitamin C, ascorbic acid, reduces ferric iron to ferrous form and prevents insoluble complexes. An acidic gastric environment facilitates iron solubility. Factors inhibiting absorption. Phytates, in cereals and legumes, polyphenols, in tea and coffee, and calcium reduce bioavailability. Clinical considerations in supplementation, dosing and administration. Ferrous sulfate, 150 to 200 mg per day elemental iron for adults. Split doses improve tolerability and absorption. Monitoring and adjustment. Monitor hemoglobin, ferritin, and transferrin saturation levels during therapy. Long-term supplementation may require dose adjustments to avoid toxicity. Conclusion. Iron supplements exist in diverse forms to address various clinical and physiological needs. Each form's mechanism of action, bioavailability, and tolerability determine its application in treating iron deficiency. The choice of supplement depends on patient-specific factors, ensuring optimal outcomes with minimal side effects. If you like my video, then subscribe to my channel. Thanks.